Welcome to Steady Balance on Spotify, your space to understand the science behind balance and vertigo.
Hi, I'm Dr. Jyoti. I am ENT specialist and I'm currently practicing in Deep Jyoti Hospital in Purnia, Bihar. So today's topic is differentiating vertigo from other causes. So whenever a patient comes to me, he says, I feel dizzy. But this term dizziness doesn't explain very much to us. So I have a long talk with the patient to get into the depth what he feels when he says dizzy. So I ask, how does it feel like? Do you feel like your head is spinning or your surrounding is spinning? Or you feel like you might pass out? Or you just feel that you are not having a balance on while walking or while standing? Then I ask, what were you doing when you got this episode? What was your head position? Whether you were in lying down position, whether you were getting up from the bed, or you were mopping the floor, or you are grabbing something from above head position. Also, I would like to ask the patient how long this episode lasted. Either it was for few seconds, few minutes, for more than 20 or 30 minutes, or it was for an hour, or it was throughout the day, or even for more than 1 month. So all these things give us an idea about the diagnosis of the patient. So there are certain things people confuse with the vertigo. So before explaining about the true vertigo, there are some things that I would like to explain. So some very common things that mimic vertigo or dizziness. So one is pre-syncope. So what pre-syncope is, whenever a patient feel lightheadedness or things go dark or patient feels sweaty or patient feel weak. So all these symptoms points toward either patient can have low blood pressure or there can be dehydration or there can have heart related condition also. So all these symptoms are very much different from the balance problem. Then there is disequilibrium. So what people feels in this disequilibrium, patient feels wobbly, that patient is swaying, patient might fall down, patient is not able to even walk, patient is not able to stand, and it gets worse whenever patient is in the dark room. So what happens? For getting a perfect balance, the three systems work in a very coordinated manner. First, we have the eyes, the ears, and then we have the proprioception. So, what this proprioception is, there are certain receptors in our leg muscles, in our back muscles, in our neck muscles. And what all these muscles do, they give signal to the brain what is the position of the body. And then we have eyes. So, eyes give any kind of visual signals to the brain. And then we have ears. So all these things, they work in a coordination and then we have a perfect balance. And if the vision is disturbed or the signal from the ear is disturbed or the signal from the proprioception is disturbed, we get a feeling of instability. And usually the feeling of instability is because of the proprioception in the legs and the neck muscles. True vertigo lies when there is any kind of defect in the ear. And in the ear, specifically, we have the inner ear. Because in the inner ear, we have certain fluids. And in the fluids, some particles gets detached and that stimulate the inner ear. And from the inner ear, wrong signal goes to the brain that causes vertigo, a true kind of vertigo. Then we have something called orthostatic hypotension. So what is orthostatic hypotension? Whenever a patient is in standing position for a very long time, patient feels that having fainting like condition or lightheadedness, or whenever a patient from the standing to the sitting position, the symptoms gets better. Sometimes patient of anxiety can also have this unsteadiness like of feeling. Hyperventilate. There is very fast breathing, and this hyperventilation, fast breathing can lead to vertigo also. And sometimes there are certain patients who are complaining of vertigo for a very long time, for months. And usually they say this kind of vertigo is triggered by movement or a certain posture. So for diagnosing any kind of disease patient, we should have clear kind of diagnosis. Is this a true vertigo, or it is a presyncope, or it is a condition of disequilibrium, or it is a BPPD, or it is a orthostatic hypotension? Because unless we get a proper diagnosis, we can't treat that patient. So after that, I would like to conclude the topic, and feel free to contact me for any kind of questions. Thank you.
A public awareness initiative by Dr. Reddy's. This communication does not substitute advice of a medical practitioner. Please consult your doctor for any medical advice.